what would you consider in terms of stem cell transplantation? Who gets that and when do they get that?
I think that, for the fit patients, if they achieve complete remission, I certainly think that allogeneic stem cell transplantation should be offered for those fit patients who are in remission. I think in the clinical study that was published in New England Journal of Medicine, 47% of patients who were newly diagnosed with BPDCN were able to undergo transplantation. Interestingly, some of those patients, there were 13 patients who underwent transplantation, and 3 out of the 13 patients underwent autologous stem cell transplantation, and there's been some data about use of autologous stem cell transplantation. However, I do certainly think that allogeneic stem cell transplantation offers better results as compared to autologous stem cell transplant, and there is scarcity of data for use of autologous stem cell transplantation. I think, again, getting back to the median age of the disease, again, that it is very important to realize that it is in late 60s, and we are not able to offer allogeneic stem cell transplantation for most of those patients. So that is a big limitations in terms of performing stem cell transplantation for BPDCN. But again, I certainly think that in terms of the outcome, the best outcome that we have for this disease is based on the patients that were able to undergo transplantation for BPDCN. So I certainly would offer for patients who are fit and are in first remission. And I think things may change. I mean, I think there are clinical trials for the anti-CD123 CAR T, which I think is certainly something is on the horizon. And, CAR T cell therapy is a attractive option for a lot of B-cell malignancies. And I think this is one myeloid disease, or I should say, where the CAR T cell has a promising promising option, and I think that certainly would be something that I'm looking forward in future to see the results from the clinical trials.
I think you almost said, you were careful, you almost said a promising potential, and that's all you could say about a CD123 CAR, since there might be a lot of off-target toxicity. Look, here, even with the novel agent, you see some toxicity. That is capillary leak. That's why the albumin threshold was placed on the original trial. So, I hope that you're correct, that engineered cell therapy will have a role, but that's something completely investigational now. You're right, the problem is the age.
Caution because of the fact that I think that the MD Anderson trial with the anti-CD123 CAR T has currently been closed for enrollment because I think they had some undesired results in their early data. So I think that certainly, but again, it's a promising option for patients who have relapse disease, and I think enrolling clinical trial is certainly allows us to evaluate other options.